what we participated in was called the Clinical Skills Competition. All of the schools of pharmacy in the nation send 2 representatives to represent their school, and each school gets the same case. So you have a patient with multiple problems, and you work up the case. You go through problem by problem. You set your goals, what you plan to do to achieve those goals, and then what kind of things you're going to monitor as you go through and give patients drugs and give them new treatments. So that was what we did on Saturday, was worked up the patient case, and then Sunday morning we were lucky enough to be named in the top 10, and we were asked to present the case orally to a panel of judges and to an audience. So we had 2 minutes to present the case, and 8 minutes of questions and answers followed.
Evan, what was it you did as you worked up the case that so distinguished you?
Well, that's hard to say. I mean, not knowing what the other people did for their cases, but one thing we really focused on in our preparation for doing the written portion of the competition was to look at primary literature and also journals, peer-reviewed journals, reviews of specific topics that we expected might be on the case. And I think that using the primary literature helped us to speak, more in a more developed tone than just using our coursework or using textbooks that we had learned with in pharmacy school. So getting to that next level of clinical knowledge of the primary literature.
And so was that basically a team strategy, Lindsey?
So I guess our team strategy was to divide and conquer. Throughout the past few months, we split up the coursework. So we went through, I focused on cardiology, Evan focused more on psychiatry, and then we both did all of the infectious disease topics. And then during the actual patient case, we also had the same strategy, divide and conquer. We would bounce ideas off each other briefly, but we always filled out the forms on our own and then proofread each other's work. So that was our strategy.
For both of you, starting Lindsey, back to Evan, going in, did it turn out to be what you expected it to be?
Well, we expected it to be difficult, and it definitely was. It was very challenging. It was a very hard case, patient with a lot of problems. But I'd never expected that we would have a patient with a subarachnoid hemorrhage. The patient had a brain bleed after a fall, but we had kind of expected a more challenging topic, and so sepsis was no surprise. That could have very easily been one of the topics that we expected. But I think the nutrition was a surprise. Didn't expect that.
Yeah, so going into the case, I had sort of expected it to be more, and this is sort of naive, I guess, more in tune to the experiences that I've already had, which are, ambulatory care sort of experiences, so an outpatient case, or a patient that's in an acute care facility but not in an intensive care unit, so critical care. And that's what the patient case was, is a patient that was mechanically ventilated, intubated in an ICU, and that's something that neither of us had encountered during our clinical rotation, so that caught us a little off guard. But again, yeah, the topics that we had reviewed, like sepsis, were things that we prepared for, just not necessarily in the setting that it was presented in the case.
At the completion of the project, did you say, "We've got it, this is good"?
No, not at all. Not at all.
We had discussed beforehand, because really our strong point is presentation. And so we just kept telling each other, if we can just make it to the top 10 where we present, then we think we can take it. But we walked out of there on Saturday after writing out the patient case and just, we both were so defeated. I don't think we spoke for 15 minutes because it was like so intense, and there was so much writing involved, and it was such a challenging mental exercise to do. So we walked out of there and we had no idea whether or not we had succeeded at our task. And then when they were announcing the top 10, we were sitting there, we'd been waiting. Neither of us slept the night before. We were so nervous. And when they were announcing the top 10, they said the University of California, San Diego. And we were like, oh. We knew that we had failed because we were like, California has been represented. And then they finally said California, San Francisco.
And then USC as well. So California had 3 schools in the top 10. And that was really cool to see, too, because we had met a lot of these other teams at the state competition. And to see California represent was very exciting. And a California school, to our knowledge, had never won the national competition before, so it's really nice to bring it home for California.
California rules.
Yeah, I'm telling you.